pulled in, yeah.
Exactly. Good afternoon, and thank you for being here today for the official launch of our Public Health and Safety Team, or what we're referring to as PHAST, P-H-A-S-T. This is an evidence-based, community-centered public health and public safety partnership to increase overall health outcomes for our residents, reduce the number of unnecessary calls taken by police, and provide the proper level of care for residents seeking intervention or services. This innovative program is led by a team of community health workers. To date, the Manchester Health Department has hired 8 community health workers, all of whom have close connections to our community. These individuals live in our neighborhoods, they speak multiple languages, and they're dedicated to creating a Manchester where every single resident feels connected and supported. The community health workers will be ward-based, and an additional worker will be dedicated to assisting our senior citizens. The community health workers serve as advocates and liaisons between our residents, city departments, healthcare providers, and social service agencies. They conduct outreach and prevention education, they coordinate care, and they improve communication and help address health inequities. And they're also working with the police department to address certain check condition calls typically taken by police officers. These check condition calls represent the largest number of calls that come into our police department, but on average, less than 10% of these calls actually require a police response. The partnership between the health department and the police department will reduce the number of unnecessary calls taken by police and will ensure that our residents receive the response that best meets their needs. I consistently say collaboration is key, and the PHAST program is a great example of the positive impact we can have when we work together to best meet the needs of our residents. This groundbreaking program is possible because of federal funding allocated directly to the City of Manchester through the American Rescue Plan. I want to thank our federal delegation for advocating for direct funding to our local communities. Our community health workers are already contributing so much. It's exciting to be able to address neighborhood-level concerns in a thoughtful and intentional manner. I'm grateful for Anna, Bahram, and the rest of our team for their hard work in getting this program off the ground. So it's now my pleasure to introduce our Public Health Director, Anna Thomas, to give more details about the Public Health and Safety Team.
Thank you, Mayor. So the City of Manchester Health Department has been a pioneer in the state with the use of community health workers to improve the public's health and access to care. Starting as far back as 2014 with our Community Schools initiative, when we co-located community health workers in 5 priority elementary schools, to the last 2.5 years of utilizing community health workers to assist us with COVID-19 response and the provision of essential services. They have been problem solvers and frontline navigators to our community because they are from the community. The PHAST team model is an innovative and novel approach in New Hampshire and this country because it is place-based. Every ward and every neighborhood within the city will be represented, and we will be adding a layer of connectivity to basic needs not one organization could ever achieve. We see these public health professionals as trusted resident liaisons who can lift the voices of so many of those who are often forgotten or unseen. They can be a source of hope and inspiration for those who need us most, and also serve as the eyes and ears and boots on the ground to what is happening throughout the community. Their primary role is prevention, with the intent of getting to individuals before they are evicted, before they become a victim of domestic violence, before they experience food insecurity or fatally overdose, before they maltreat a child or commit an act of violence or crime of desperation. The City of Manchester Health Department has always focused on measuring success when all Manchester families and residents thrive and give back to the greater good. And in fact, this is the definition of recovery and resilience, which is the intent of this funding. So before we introduce the supervisor of the PHAST team, it is my great pleasure to ask our Chief of Police, Chief Alan Aldenberg, to say a few words about this partnership. Chief?
Good afternoon. Thank you, Mayor. And good afternoon, everybody. I'm excited to be here today to discuss the formation of the PHAST team. This initiative has been years in the making, and we're happy to be part of it. We are fortunate to have a long history of partnership with the Health Department, and the PHAST team enhances our collaborative work. In policing, one of our top priorities is to prevent crime and disorder. This focus on prevention is closely related to public health efforts and is the intersection of public health and public safety. Our goal with this program is to use police-related data to help identify issues within neighborhoods and work together with FAST to solve those issues before they get worse. In action, this work is enabled through day-to-day communication between our police community coordinator, Rich L., who's here today, and the FAST team. Our coordinator uses trends in our data to identify issues where community health workers can employ their unique skills to provide positive outcomes. Solving these issues can be very impactful on reducing violent crime and is a key component to our gun violence reduction strategy, which we have already rolled out. FAST workers bring their skills to focus on neighborhoods in ways that law enforcement can't. For example, we work together on crime prevention through environmental design assessments to improve environments and remove crime attractors. Additionally, FAST workers are community connectors to bring residents together, which increases community cohesion. Both these examples are evidence-based crime reduction efforts, which will have positive impacts for the City of Manchester. We also coordinate with FAST to identify high-frequency users of police services, like the Mayor had mentioned, for non-law enforcement purposes. These calls take up significant amounts of time, and FAST workers are better able to provide assistance to these individuals. Oftentimes, the resources that community health workers can provide will resolve conflicts and solve problems before they become larger issues. Through providing this alternative response, officers are freed up to focus on policing matters and safety issues. As we continue our work to reduce violent crime here in Manchester, FAST is an innovative approach to do so. The role of the team will continue to evolve, and I look forward to seeing positive outcomes that they produce. With that, I'd like to introduce Baram, the supervisor of the FAST program, who is, him and his team are the ones that are going to be doing all the work. So I think it's important to hear from them.
Thank you. Thank you, Chief. The Honorable Mayor, Joyce Craig, Manchester Police Chief, Alan, and also Manchester Public Health Director, Anna. Before I introduce this team, the FAST team, I must admit that I have been fortunate to work with this team of brilliant men and women. This team is composed of 8 community health workers, one serving as a supervisor. All 8 of us are residents of Manchester City, and one thing is common among us, is that we love this city, and each of us is a trusted member of the communities we serve. In addition to the list of credentials you will hear about us in this introduction, each of us is multicultural and multilingual. So I'll start with Mary Chantal. Mary Chantal is assigned to Ward 6, Census Tract 6, Ward 6, and Ward 2. And her bio Mali Central has been providing direct service delivery in various roles since 2004 and has experienced a community health work in Rwanda. She has a bachelor's degree in clinical psychology. Then we have Luisa Leger. Luisa is assigned to Census Tract 2004, Wards 2 and 3. Her bio, Luisa has an experience working in a vast experience working in human services. She has worked as a medical assistant, orthodontist assistant, and most recently, correctional officer with the psychiatric unit, state prison. So Luisa holds an associate's degree in behavioral health science. Then we have Gabriel. Gabriel is responsible for Census Tract 14, Wards 3 and 9. And Gabriel has worked with Amazon as associate for a year. Prior to that, he worked as a high school chemistry teacher for 5 years. And Gabriel has a BSc, that's Bachelor of Science degree in chemistry from Etiki State University in Nigeria. Then I turn to Wanda. Wanda Castillo is assigned to Census Tract 15, Wards 4 and 5. In terms of bio, Wanda comes to us from Amescake Health. She has served as a community health worker and team leader since 2015. She has 20 years, now over 20 years of direct service delivery experience in Manchester, working in various topic areas, including, but not limited to childbirth education, HIV prevention, chronic diseases. She is currently working on completing a bachelor's degree in psychology. Then we have Neera Kanda. Neera is assigned to Census Tract 19, Wards 6 and 7. In terms of bio, Neera is experienced as a field researcher, surveyor, and program officer in Nepal, where she worked on various topics, including, but not limited to, human trafficking, displaced youths, peace and integrational efforts. She has 2 bachelor's degrees, one in law, humanities and social science, and a master's degree in rural development. Then we have Isaac Rugali, assigned to Census Tract 16, Wards 8 and 12. Isaac has worked with Easter Seal as a resident instructor for 5 years. He is also a licensed medical interpreter and nursing assistant. Isaac holds a bachelor's degree in applied biology from the University of Rwanda. Then we have finally, not the least, Nisha. Nisha is responsible for Census Tract 20, Wards 10 and 11. She's a licensed nurse and a banker by profession before joining this team. Nisha has a bachelor's degree in business management, majoring in marketing. Then my humble self. All right. In addition to my supervisory experience, I have served in various roles as a journalist. Some of you are doing right now. Medical research, education, and healthcare. In addition to my certification as a recovery coach, I'm also a licensed mental health first aid instructor. I also hold 2 bachelor's degrees, one in education and public health, but I also I hold a master's degree in public administration. So, in terms of training, this team, each of the team members has completed the Southern New Hampshire AHEC Community Health Worker Program, which is a 56-hour community health worker training. And also, each of us also has got training on how to introduction to outreach method and strategies that is provided by New England Public Health. In terms of organization, agencies, departments we've been working with, through our partnership with Manchester Police Department, we've been conducting SEPTED which is a crime prevention through environmental design, assessment to different places referred by the police department as hotspot neighborhoods. The team has also been regularly visiting their wards, census tracts for similar assessment, and also to see quick fix things that are not looking right in those neighborhoods, like broken sidewalks, faulty street lights, bulky trash that is not picked up. So, also we've been working with Meals on Wheels. We've successfully inherited all Meals on Wheels calls that used to be referred to the Manchester Police Department. We took over those calls from the 6th of this month and has so far assisted 9 residents. I want to share with you what one resident told us last week when we did a check condition visit on him. This is, I quote, "I appreciate that you guys are doing this for us, so the police can take care of their other important jobs," unquote. So we've also been doing, working with the community response unit. This team has also been going out with the Manchester police officers for outreach on people who have recently overdosed. We've also been participating with the Healthy Corner Stores program. The team has been participating with the Healthy Corner Stores program and have helped in identifying and enrolling 7 stores currently on the pilot program. So in terms of referral from all other sources, to put our caseload together, I can confirm that we have at least assisted 62 residents for different things, including but not limited to connecting them to the following: housing, childcare, behavioral health, employment, food, clothing, health insurance, etc. So on that note, I thank the team and thank everybody for your kind attention.
If you have questions, take them now.
How much will this cost, and what's going to happen after our program is out?
It's a really good question, and actually we grapple with that all of the time in the health department because, as you know, many of our projects are grant funded. But this is a 5-year trajectory, so we've got time to be doing that planning for sustainability. And I think, you know, we've received some questions from some of you, how come we don't have 12 hired yet for every single ward? And we're trying to scale up and out and get this pilot off the ground with this first set of 8 community health workers, because we're now finally at a point, now that everyone's trained, everyone's got their ward assignments, we're starting to roll out into the community. So that's one of the goals of today, is to really message to the greater community that this team is now available. We want to communicate with all of our nonprofit partners and so forth. So we really have to gauge what the volume and intensity of need is going to be before we start adding additional members to the team. We are absolutely going to be adding a senior services community health worker, because a lot of these calls are our frail, isolated seniors, and we know we need someone with just that specialty. So that will be an additional team member. But I think that's what's going to happen in the coming years, is really seeing how far we can reach into the neighborhoods. And we want to continually communicate the data and the impact that these individuals are making. And I think over time, that's where we're going to think about the structuring of what's the financial future of keeping this going. All of the budgeting information is available. I think we actually included a link in the press release itself that will give you the breakdown of the budget of what it would cost to actually staff all 12 wards plus the additional senior services person. But I think what we're going to do is kind of work towards it every year to see what's this going to look like for sustainability. And just like anything that we initiate in the city, we have to prove its worth. And then if there's value added, certainly, which I'm absolutely convinced it will be, for not only the aldermen, but all of our constituents and our school board members as well. Don't forget, they're ward specific, and they have a lot of families that they're also trying to link to assistance. So these guys are going to be busy. I have no doubt they're already busy now as they're ramping up. But today's really the first time that we're kind of coming out to the bigger community to say they're ready. We're going to get out there. You're going to see them out in the community. We're going to be messaging about them and all of their success stories. And we'll see. We'll see what 5 years does, and we're absolutely convinced that we'll turn around the outcomes that we set out to achieve. Yes, sir.
Biram said that 62 people have been helped already. What's the time frame on that?
That's a really short timeline because some of these folks actually just started a month ago. So I don't know if, Bahram, you have a window that number that you just gave, the 62 number that you're actively serving right now, was that based off of the past month?
Yes,
Okay.
from the time of inception.
Okay.
From December.
Right, so we just started, I mean, Bahram was just brought on literally in December and November of last year. So this is like we're hiring people along the way. So now we have a fully assembled team. So their active caseload right now is that 62 number, but we're anticipating that once we really get out there and message about this, and we'll be communicating this to the aldermen tonight, their phones are going to ring. So, and we'll communicate all of that data back to all of you so you can keep track of the performance.
Based on what they were assigned to each department?
So, I'm sorry, say the beginning again?
Based on what data or what parameters they were assigned to each department?
Yeah, so some wards are just busier than others, and there's higher populations. So, you know, we kind of gave it great thought for like, how do we start the first group based on the activity of the calls that we've seen and really try to use the data to drive the decision making. But I think our real vision is to just have someone available for every ward. And keep in mind, even though they are being ward specific, they don't, across this team, anybody could call any one of these community health workers if they had a question, especially if there's language barriers, for example, and you guys have the breakdown of kind of who speaks what languages. Many of these community health workers speak many languages. So they could call any member of the team at any time with a question. But we are trying to, you know, kind of divvy up the work, if you will, geographically specific. And again, we'll see, based on the volumes of calls that the police department's receiving and some of our nonprofit organizations and their referrals, we may have to kind of shift people around. Again, we're going to play it out by month and make adjustments as needed.
Are you targeting the assistance to certain populations in the city, or are you doing this to everybody?
It's available to everyone, and you know, there's a range of needs in the city. And again, I want to kind of reiterate our frail elderly. A lot of what we've learned through COVID, unfortunately, is that's one of the most vulnerable groups in the community that we have. And I think we're going to be doing a lot more planning around healthy aging in Manchester for years to come. So we're getting prepared now. We want the boots on the ground ready to reach these individuals and to give them the assistance they need. But anybody can call for assistance. I will tell you, as public health director, I get a lot of calls from aldermen and other constituents calling because they're concerned about somebody in the community. And they ask us to go do a home visit, for example. It might be a new mother. It might be a frail elderly person. And we'll go ahead and do those visits. But now we have community health workers who can do that. And then also follow up with these individuals, because it's not a one and done. You know, often we step into the home of someone who, you know, we get a call because their plumbing was shut off or they may have other needs. We walk into that home, and just like in the olden days when doctors used to do house visits, they would walk in and assess that environment. And we end up coming up with a list of things that that person probably needs. And our community health workers now can help prioritize those needs and work with that individual, you know, one by one to kind of, you know, check the things off the list. Because if they've got one need, they tend to have many more. So they do a little bit of an intake and an assessment overall on the person, even though they might be calling because of one need. So we can get ahead of all of those issues before they really exacerbate. So that's the goal, is, you know, we're trying to be upstream with our efforts, and we don't want to respond to people when they're in dire straits. And that's one distinguishing thing about this team, is they're not first responders, they're not police officers, so we have to sort out the roles a little bit. They really are there to do all that upstream work. People need help filling out paperwork, they need connections to services, they can help make phone calls. They're really there to be that problem solver on all of those basic needs for every resident if they need them. And you had a question, I'm sorry.
you describe everyone's experience and language,
Yes.
and work history and education is exactly what we hear and
Yeah.
what others want to do, is have a diverse
Yeah.
outreach group that comes from the community. So you achieved it. How did you handle recruitment?
Yeah.
How did you approach that?
Well, I mean, we started years ago, so this is not new to us. You know, we've really been committed to having a staff at the health department that looks like the community. The other piece that I think we're kind of underselling here is all of these individuals, not only are they super talented, they've got a plethora of educational backgrounds, but they have lived experience that you could literally do a story on every single one of these individuals, and I would love it if one of you actually featured. So I'm going to go and plant that seed. Every week you could do a story on a different individual because they have faced adversity themselves. And they have learned from real experience how to pull themselves out of that and succeed, and that's why they're here today. So they can directly relate to when a resident is struggling. They know what that feels like, and that is one of the most powerful things that they're able to bring because they can connect to residents and build that trust immediately and much more quickly than we can do just collectively as city departments because they're out in the community. They know many of these families. They're able to, build that trust, get to families very quickly. And, that's really the goal, is to have an extra layer of frontline staff who can really just immediately get to the community when we need to.
Is there an expectation that this group will help homeless individuals or other people in a proactive way?
Yeah, so that's a really good question. So you all know Shauna Green, our Director of Homeless Initiatives. And, Shauna is no wallflower, and if she had her way, she'd probably take all of these community health workers on a regular basis. They really are not to solely do that work. If there was specific instances where they can do assistance, certainly Bahram and some of the other team members are going out now with the CRU to do follow-up with people who have either recently overdosed or who are at risk of overdosing. Some of those individuals, not all of them, are in encampments or they're in hard-to-reach places, and they're going out with those teams now. So we could literally just have a team doing that on a regular basis, but there's also lots of other teams doing outreach to individuals who are experiencing homelessness, specifically in the encampments, but certainly throughout the community. And we're also, the other hat that hopefully that we wear is we run the Healthcare for the Homeless program with Catholic Medical Center. And there are outreach teams through that mechanism, plus we have 3 clinic sites where we are providing primary health care for all ages, including children. So there is some overlap. The other department that we are working very closely with is our welfare department. So there may be individuals who show up there, and the welfare department now knows because this team is right next door to them, and they could immediately walk that individual over and say, hey, can you work with them? They might need some help with this, this, and this. So there's a lot of cross-pollination, and we're just beginning. So we're hoping that we're going to be able to reach out to a lot of the programs in the city and say, hey, including the hospitals and the ERs. There's social workers in the ERs now, care coordinators. So this might be another linkage for them that when somebody's discharged from the hospital, they might need some additional help once they get home or to wherever they go. And again, this team might be able to do some of that assistance.
Are you, what kind of criteria are you using to judge the success of this program?
Yeah.
To be 5 years when you're
Right.
coming runs out.
So we have metrics already pre-designed. I'm looking at Lieutenant Barber in the back because he's been instrumental because he's a data-driven guy. So it's everything from just the sheer numbers of people that we're seeing, but more specifically because we're using the platform Unite Us, which is a care coordination software program. So we input these individuals into the system with their permission. And then what this system does is actually track all of the services and the referrals that we're making. And, our job is not just to make the referral, we're also ensuring that they're getting to that appointment or making that connection. So that's what Unite Us will do, is it'll actually track how successful we are in bridging that gap. So that's just one of many sources of information, but we also want to get a sense of what kinds of calls are we getting? Is it for food security, for example? And if it is, then that might feed our work doing the Healthy Corner Store initiative, because there's some crossover there. If we're seeing a lot of questions about housing needs, then we need to work with our housing providers and give them that feedback. So, the other entities that we're hoping to connect with, that we've already had them speak with the team, are entities like 211, who provide information and referral. So they can immediately, if they've got someone that might need a little extra help, they can connect them to a member of the team as long as it's a Manchester constituent.
Do you have any broad goals, like for instance, increases in or decreases in the poverty rate?
Yeah.
Increases in life expectancy?
Yeah, listen.
Decreases in
Yep.
infant mortality?
Yeah.
What are those?
Yeah, those are some of the big measures. I don't think I can solely say this team is going to reverse. Those are big population-based measures. They certainly are going to contribute to the reduction in those numbers, I have no doubt. And the more that we can empower residents to be their own problem solvers, so this is the other piece that is really important. We don't do anything that's a hand out. This is all a hand up. So the better that we can equip the residents to be their own problem solvers, the stronger they will be when they face future adversity. So the more that we can work with them and walk them through how to tackle hard problems, the better that they are equipped with being able to do it themselves. Because at some point, we're there to help them at the time that they need us, and we hope we get them back on their feet, and then our success is when they don't need us anymore. So this is all part of that Recovery Act. I mean, the whole idea is, how do we get people back on their feet, back to being contributing members of society? And that's what these guys are going to help individuals do one by one. The work is really intensive because, as I mentioned, you might walk in because there's one need that we've been called upon, and they're going to open up a whole list of things that may require multiple phone calls, multiple people helping. And that's the depth of the team, too, that they actually can work together, not just one person to one person. They could work as a team around a person or a family if that's what's needed as well.
If I could, for the chief, no. They talked about a reduction in welfare calls,
Yeah, check condition calls, yep.
Upstream stuff about solving problems before they metastasize into crime.
Exactly.
Do you see this reducing the police ranks of police officers you need, reducing your budget?
No.
eventually?
No, not at all. Not even close. I'm trying to reduce those check condition calls where, or maybe not. We have to go to that initial check condition call and identify that, okay, this is not a police matter, but I now have, like, in the past we would, tell the person, hey, you can call here, and it was really never any follow-up. So the calls would continue, right? Because the person didn't really have the capabilities or the wherewithal to actually kind of follow through on their own. So now we have this, right? So now I can go to Rich or my supervisors, and he can review the calls every day and say, hey, we got 5 check condition calls in the last week from one resident, right? So why we keep going, now I can reach out to these folks and get us headed in a better direction. And so freeing up my police officers on the street to go do things that aren't more important, but are more in line with their duties and responsibilities. Because we've recognized over the last few years that police aren't going to solve every woe in society, right? And I think this city in particular has recognized that on many fronts, not just mental health, homelessness, and now this initiative. I'm super psyched to be part of it, and I think we're heading in a fabulous direction. So no, I'm not going to need less police officers because of this. Long answer to an easy question.
Thank you. Okay.